We're gonna have to do a lot of admitting people. Hi there. Hi, Tanya. I see you guys on here and Al. So we're probably just going to wait a minute or two until maybe a couple people join, just to kind of get everyone situated in the same place. If you guys know if you already have questions, you can just go ahead and submit them. Um, we are also live on Instagram, so we're kind of toggling between the two. But we can introduce ourselves.
Yeah. Hey, so Tanya, I know you know us, but I'm Nathan Unkefer, an emergency room doctor who has recently transitioned into the psychedelic world and working with ketamine for mental health. And I'm kind of the medical guy behind our duo, and Shandell being more of the emotional and spiritual side of it.
Yeah. And I'm Shandell Pino. I'm an energy healer and psychedelic integration specialist, and a ketamine sitter. So I'm there to support your a journey from beginning to end.
And we have seen recently. A lot of people that have a lot of different questions about ketamine, and you see the media talking about it, and you hear these buzzwords, and you get, headlines about it, but um, not a lot of people actually understand what it is or what it does or how you do it. And so we were hoping to use tonight. It's just an informal way to kind of chat about it and answer some questions.
Yeah. We get a lot of people that will just like quickly send messages and be like, what about this or what about this? And so we thought it would be a really great opportunity to address all of those questions all at once, and then answer anything additional that people come up with. We had just a few people send in questions prior. So we can start with those if you want to go first, because it's the first question is kind of in your wheelhouse more than mine.
Yeah, so one of the questions which I thought was a good way to get started is simply what is ketamine and what does it do? Right? So you hear, like I said, you see this stuff in the media and they talk about neuroplasticity and opening up neural pathways and resetting your brain, but like, what does that actually mean? So I was going to just give a kind of a really quick history of the drug and how it works. Um, it's funny because it's ketamine's been around since like the 1950s, and it was initially derived from PCP, the street drug PCP, or angel dust. Is
Mhm.
PCP angel dust? Yeah.
Yeah.
And so PCP was originally discovered in like 1900 something. So PCP's been around for forever. And they started using it for anesthesia in hospitals, like one of the first anesthesias in hospitals. But it had a bunch of really bad side effects, profiles that came from it. Specifically, that people would come out of the sedation um, kind of psychotic and angry and fighting. And that's why PCP gets this bad rep as a street drug. Like it's the guy who's naked and punching the police dogs, right? So PCP has all these bad side effects. So in the 50s, scientists took the PCP molecule and they tweaked it a bunch of different ways. They removed some of the side chains, added some side chains, and they came up with a handful of different drugs and they tested these new drugs on prisoners to see what the effects would be like. And the one that seemed to have the best profile that would sedate people really well for surgery, but not have like the violent side effects, was ketamine. And it's crazy because back then they didn't even know why it worked or how, like, what it was doing in your brain. They just saw the physical effects of it and said, "Yep, this one works." Um, and started using it for anesthesia in hospitals. They also use it in veterinary medicine. So a lot of the times in the popular media, you hear it described as like a horse tranquilizer, which is true. They still use it to sedate all kinds of animals, but it's been used in human medicine probably more as an anesthetic. Um, in my job as an emergency room doctor, we would use it for knocking people out for painful procedures. So if you came in with like a dislocated fracture or something super painful, and we just needed you to be comfortable while we did what we needed to do. We'd give you an injection of ketamine, knock you out. It only lasts for about 45 minutes to an hour. It's got a really good safety profile, so it doesn't have much of an effect on suppressing your breathing or messing with your vital signs. So it's kind of perfect for the ER. Give you a shot, you go to sleep for an hour, and we can do whatever we want to you during that time without you remembering and without you feeling. So that's kind of like where ketamine came from. But its history with mental health is that in the early 2000s, there was it all kicked off from this single study where researchers took seven patients and they gave them all, seven patients with severe treatment-resistant depression, and they gave them all ketamine, a single dose of it, and then questioned them afterwards in terms of how they were doing with their depressive symptoms. And like all seven of them reported that they felt great. And then it was kind of like, okay, well, what does that mean? And so then that spurred like all kinds of studies that came off of that. And it's been, I think there's over like 700 peer-reviewed published studies now that focus on ketamine for mental health. Um, and over, it is showing that in general, and it depends on what study you look at, but upwards of like 75% of the people that are treated with ketamine will report that they have significant improvement in their mental health symptoms, mainly depression, anxiety, and PTSD. Those are just like the three that have been studied the most. Um, and then what else was I talking about? Oh, why? Like, oh,
How does it work
but
in the brain?
even in the early 2000s, we didn't totally know why it would work. Like, why would an anesthetic make you feel better? And so it hasn't been until maybe the last like 5 or 7 years that the research is getting down to the molecular level about what ketamine is actually doing in your brain. And what we're finding, and again, it was still probably early in the research, we don't know everything about it, but what we know for a fact is that it binds to a receptor in the brain that normally binds a neurotransmitter called glutamate. And glutamate doesn't get a lot of attention. Like everybody has heard about serotonin and dopamine, norepinephrine, but there's another neurotransmitter called glutamate that also has to do with regulating your emotions. And ketamine binds that same receptor, and it leads to kind of this cascade of events that trigger a whole bunch of neurons firing all over your brain at the same time. So, I mean, almost like a seizure, but more organized. In fact, ketamine is used to prevent seizures, so that's not a concern. But you get all these neurons firing all over your brain, and it lasts for about 45 minutes to an hour. And during that time, your consciousness, yourself, your brain, doesn't know what to make out of all these new inputs because neurons are firing all over the place. It's in a pattern that you would never see in like day-to-day life. So your consciousness sees all these neurons firing and it presents you with a picture of what it thinks is going on. And that leads to the psychedelic experience. So you get neurons firing in your occipital lobe, which is the visual cortex. So your visuals get scrambled. Your sense of body gets scrambled. So you feel like you don't have a body or that you're floating or that you're traveling forward. Um, your thinking gets a little scrambled, so you get a little jumbled in your thinking, and it's a full blown like psychedelic um, effect, similar to other psychedelics, which we can talk about if we want to. But there's like psilocybin, which is magic mushrooms, or LSD, acid. You get a similar kind of psychedelic effect with ketamine, but where the real beauty comes in is that after you get that 45 minutes to an hour of a psychedelic effect, for some reason that like rapid firing of neurons all over your brain stimulates your neurons to form new synapses. So synapses are the connections between neurons. So there are studies in mice and humans that show that within 4 to 6 hours after a single dose of ketamine, you have this proliferation of synapse growth, and new connections between your neurons. And you can literally open up new like neural pathways. Um, and this is what the media likes to say, neuroplasticity. But you open up these new neural pathways and it can give you just a little shift in in your perspective or in how you think about your emotions. So if you've been stuck in a rut, always with the same thoughts, whether it's depression or anxiety or trauma response, and every time there's a trigger, you get back in that loop of thinking. The thought with ketamine is that you will form all these new synapses, you open up chances, new chances for, or actual new neural pathways. And so the next time there's a trigger, you might just not fall into that old pattern. You might not have the same depressive anxiety response. And it just can shift your perspective enough so that you get away from the old stuff and just start to feel better.
Well, I'm going to step in real
Yeah.
quick. And with like the new neural pathways and the new synapses all like working together, you have such a good opportunity to tell your brain what you want it to do instead of the old pattern. So if your old pattern is depression, then your new pattern gets to be what? And like that's kind of where I come in is like what is it that you want to have happen in your life? And so you become very intentional on what you're doing to tell those neurons what to do next.
Yeah. And I think that's a great point because another buzzword people will say it's like fertilizer for your brain, right? So it stimulates all this new synapse growth, but you can't just plan on the new growth
To know what to
to
do.
know what to do. And it can be tell it to grow into some positive loops. You still have to do the work to try to encourage the right type of connections. And so I learned early on in my journey with ketamine is that I don't know what I'm doing when it comes to that, right? I'm an emergency room doctor. Um, the reason that you need me, because there are some side effects or some possible complications that you need me to make sure that doesn't happen or to deal with if it does happen, to keep you safe physically. But I learned early on, like there is so much more to it. Like there's this emotional um support integration that needs to happen because once you get the ketamine, then it's your job to try to figure out how to form those neural pathways into positive loops.
Right.
And I don't know, I don't know if you wanted to talk about what that means or what you do or
Mhm.
why we need you instead of just the medicine.
Yeah. I mean, so, like he said, everything is firing and everything is going, and you have this beautiful opportunity to create lasting change in your life. I worked with affirmations for a lot of years before ketamine came into my space. And we used to have to do it the long way. Like I used to say, okay, you have these neural pathways that you've been digging like a trench for years and years and years. And now you want to start something new. You have to get out your shovel. You have to start digging the trench. And every time you dig the trench, you put the dirt in the old pathway. And that's a long time. You have to do a lot of, self-talk, a lot of all of these practices that I would take people through. And now with ketamine, it's like a fast track. So instead of you having to dig, it's like dug and it's like, well, what do you want to put in there? What seeds do you want to plant? And so you can plant those seeds. And then again, like he said, once you're given the opportunity to make a choice when you're met with a situation that previously was a trigger, you have that in your mind, whether it's through affirmations or intentions or specific wording that you can use that you're like, oh, actually, this is my new choice and I'm going down this way instead. And it just becomes really powerful and it creates lasting and long change in your life. And you can do the ketamine and not do that, and you will still have benefits of like, I feel better, not quite sure why, but then if the effects, as far as I'm concerned, the effects don't last as long. You start to revert back to old patterns and you start to revert back to old thoughts. And then you're like, oh, here I am again. I need to go again and again and again. And we're trying to get you to a place where let's get you to a healthy mental health state do the work that really gets you grounded and feeling yourself, and then you're not going to want to see us for a while, other than you like us.
Okay, no, I think that's a pretty good summary. I mean, we could definitely get deeper if there's questions specifically about that kind of stuff, but that's kind of a good summary about what it's doing in your brain and what you then need to do. Because it's not like a light switch being flipped. It's not an immediate cure-all. Uh, Nothing ever is. But the combination of like stimulating those synapses and then having the support to try to train them into the right connections. That's kind of why we feel like the two of us working together is so good.
And so before we move on to the other questions that came in, since Kate, since you're here, and Tanya and Al, since you're here, do either of you have any specific question that we can answer for you? Or if you're like, no, I want to kind of see what you say, then we'll keep going. And then again, we can ask later, or you can just chime in.
Well, I kind of presented my question to Shandell a little earlier, and I'll kind of explain where I'm coming from. I told her my analogy that I had heard with ketamine was like when you are out in the snow where you've seen a lot of ski tracks and there's just thousands of ski tracks and you don't know which ski track to take. Ketamine is like a foot of fresh snow on top of those old tracks that now you can decide which path to take, and it can be fresh and it can be new and it can be awesome. But my fear is, what if I step and I post hole and I trigger and I go back to an old way of thinking while I have that flexi brain going on and that immediate after effect when everything's fresh and new firing and I make a misstep? Is that going to set me back, or can I switch it while I'm still in that recovery phase and be like, oh, no, don't do that. Do this kind of thing. Like, I'm afraid of post holing in the fresh snow is basically a way to analogize that.
Well, and I love your analogy because I know you and I know how much you love to go up in the snow, right? So, um, I'll take this for a second. So, yes and no, right? Like we've heard these stories of these people. They're like, oh yeah, I was just scrolling on my phone while I was in ketamine. And I was like, oh my gosh, do you know what you're doing to your brain right now? Right? Like, or they just go back to their normal habits, or they go get in a fight with their spouse, right? You can like reaffirm certain patterns, but that's why it's so good with to work with somebody like a therapist who knows psychedelics. I'm going to preface that. You really want to work with a therapist who has had psychedelic training, and or has experienced psychedelics themselves and have done their work around it, or someone like me who is a specialist in psychedelics because I've gone through like training and learning and like trying to really pin down exactly how it helps you. But you can have this experience where you're like immediate old pattern, and then you're like, oh wait, but it's the awareness because you even just said it. You're like, oh, wait, I don't want to do that. I'm going to do this. Even that moment is going to make the shift and the change. But it's so important to do the pre-integration, the like, what is your intention? Why are you wanting to do with this? What is it you wanting to get out of creating some affirmations, which is what we do when we work together, and then really being very intentional because we say that, I mean, I always say 48 to 72 hours to program your brain. So imagine that you are super, super intentional for 3 days, 3 days. And then if in that 3 days you do something that is an old habit and you're like, oh, dang, you don't want to immediately attach yourself to that and then be like, now I screwed it all up. Now this is all over. This is just nothing, right? You have to be like, oh, that was a moment and I'm still making these other choices. So that's what we mean by like being you doing the work after the fact because you can reaffirm some of the patterns that are already going if you're not aware of it, which is why like part of what our passion is to truly teach people how this medicine works and why it if you work with it it can be so powerful instead of just throwing you in a chair and then letting you leave and scroll your phone the rest of the night.
So if we have a therapist that we work with,
Mhm.
independent of you, but obviously they're not tied to your practice. So what is better or recommended after a treatment to just talk to somebody like you who may know our goals, or to immediately go and have a session with a therapist like within 24 hours to kind of work their theory when I'm flexy.
Yeah. So if you were to come have sessions with us, right, then I would still take you through just like the mini series that I'd offer with people. The pre-integration call, so I help you get very clear on what you need, what you want, your affirmations. I sit with you, then we have a call or a text after and just check on you. How are you doing? Do you need any extra support? But if you are already working with a therapist, then I say book a ketamine session, therapy session, so that they can support you there.
Yeah, especially if the therapist is comfortable with the psychedelic integration.
She's the one who recommended it to
Mhm.
me.
Yeah.
Yep.
Yeah. So just getting back to her, I also wanted to speak quickly to your first question about this fear that you can have this neuroplasticity and take a step backwards instead of forward. And again, this is outside of my wheelhouse as an ER doctor, but what I can say for sure is that if you look at the studies that ask people how they feel, because a lot of them are just questionnaires, like your depression score today, and give you ketamine, and then ask your depression score in 3 days and 7 days and down the road. There's about 25% of the people that don't respond. They feel no different. They don't get better. But what you don't see is people going backwards. So there's not a subset of patients that get worse, right? So there's about 25% that just continue on as is. And then, up to about 75% of the people feel better. But for whatever reason, we don't really see people like regressing from it.
Mhm.
And I don't know, I don't think anybody knows why, but it doesn't seem to be a big risk.
Okay.
Is that helpful?
Yes, very much.
Mhm.
That was like a big fear of like you almost have to think perfectly post treatment for fear of like backsliding or putting in a bad track in a in an old pathway. You don't want to reaffirm that old pathway.
Right.
So that was my big fear of like relaying down bad tracks when you're so neuro you're so I don't what's the word you use? I keep saying flexy when your brain's all flexy and fresh.
Yeah, I mean, that's good too. They call it neuroplasticity, plastic.
When your brain's all flexible is how I keep
Yeah.
thinking of
And
it.
and like you said, like even if you do make a choice that goes down like an old path, you've still created so many new options. And so that's why you're not going to revert backwards, is because you've already still created so many different new options that if this pattern just kind of stays, you're like, okay, well, I keep doing that still, but I'm also doing all of these new things, feeling all of this new way, feeling light, happy, easeful, things like that.
And a lot of the early studies didn't incorporate any kind of integration at all. It was just, here's your medicine, go back to life, and we'll see how you do. And even those studies, like yeah,
People
I
feel
don't know
better.
what the percentages are, but like people felt better. So you don't have to. Well, this is like the big. This is what I tell people all the time with this. You can't screw it up. Like you're not gonna do anything wrong to like implode. Even if you do nothing to help yourself, there's a good
Good
chance
chance
you're
you're
still
going to
gonna
feel
feel
better.
better. And if you do the right steps, you have more success at greater improvement. But it's not like I said, the studies just don't show people feeling worse afterwards for whatever reason.
And I'll touch on that for a second too, because like you can feel better after one session, right? We recommend a series of six. There's a reason for that. But I don't want to go into that right now, but I want to go into like boosters. So a lot of times people will have a series of six, eight, whatever it is. And then because it stacks on top of each other and you're building, 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 and then you're supposed to integrate. Some people do, some people don't. The people who don't and go back to their normal lives, they're going to come back for a booster 3 months, 6 months, 9 months, or a year later. I'm a firm believer because I believe in like how to program the brain and program all the cells in our body, that if you're doing the work in between each session, then you've really solidified and solidified and solidified. By the time you get to the end of your sixth session, you're so good and you're so set. The chances of you needing that booster is a lot smaller. Now, there's no studies around that. That is my personal feeling and opinion. And so that's why I want to encourage people to actually do the work and not just depend on the medicine to be the cure-all.
Okay, that's helpful.
Yeah.
I don't want to monopolize any more of the time.
Well, and yeah, if you have any other questions, let us know. We can ask Tanya, and then if you think of one, we'll come back to you. Tanya, I saw that you unmuted for a sec.
I did. And you both look great, by the way.
Thank you.
It's good seeing you.
You too.
Like I had told you the other day, I mean, to me, I like to be in control, right? Not always a good thing, but it is the truth. And so my concern is while I'm doing the ketamine treatment, my fear would be that I'm not in control, like of my thoughts or even my body, right? Like, so what is that experience like?
Can I go first?
Yeah.
Okay.
Yeah. And in fact, this would probably be a good time to just kind of describe what the experience is like in general
Because
too.
that was one of the questions is like, I've never done psychedelics before. What does it even feel like? So, you know, so many of us want to have control and have this perception that if we can control everything, then we can control how happy or how well our life is going. And control is just a perception. And when you're in the experience, the number one thing that we say is to just allow yourself to be a witness. There's nothing you have to do in there. There's nothing you have to figure out while you're in there. You just get to lay back and watch a really cool show that your brain is like, let's come up with this. Sorry, right in front of your face. Come up with this. And so the need for control is something that can put you into what they would call a bad experience, because then all of a sudden you're like, I can't do anything in here. I want to get out. So because I can't control, I want to get out. And that becomes a really difficult space only when you don't have the support, right? So like if you're in a room alone and you're like, this is freaking me out, I want out, like I don't know what to do, I can't stop this from happening, that's a really scary place to be. But as far as control goes, you have to be able to let go of all control. You have to be able to say, there's nothing I have to do right now. There's nothing I need to figure out right now. I just get to be a witness because there is nothing to do, right? It's just like you going to sleep at night, whether you can fall asleep or not, right? If you're a stress sleeper. But like once you fall asleep, your brain is just like, yeah, we're good, right? So when we try to control, it becomes difficult. And when we just let go and become a witness of our experience, and not try to figure it out, not try to control it, not try to do anything about it, you start to relax. Now, the nice thing about ketamine is it is a bit of a dissociative. So you dissociate from your body and you might be like, I don't even feel like I have a body right now. Go ahead.
You probably were just about to say this, but you dissociate from your feelings a little too.
Right.
So you don't feel like you need that control once you're in there. It's kind of like, oh, this is what it's supposed to be like. Like
Right.
it really disconnects you a little bit.
Yeah. Yeah. And so that I was. So thank you. We talk this all the time. So because it also dissociates you from your thoughts and your emotions, it's kind of like this, oh, I don't really have anything to do. I guess I am just going to sit and watch this. Now, some people are like, I don't have a body, and so they'll kind of do a little bit of this, and we're like, that's normal for you to like double check that you're here, right? But when you have somebody like me that's a sitter, and you're like, Shandell, am I still here? I'm like, yep, you're right here. And that's all you need to just anchor yourself back to awareness. The thing about ketamine also is it will send you out to the universe. But if we were to say, Tanya, you would pull right back. You would know where you are. You would know what's going on. Some people have said they can kind of control the visuals a little bit, but not in a way that's like controlling, but like, this was really cool. I wonder if I could see this, right? And those types of things. But we just encourage you to just allow yourself to watch it. And so as far as control goes, there is within the first 15 minutes, because he gives you one shot and then 15 minutes later gives you another shot. there is that kind of window where you're just dropping in and then you can feel it a little bit and you're like, oh, okay, yeah, I'm starting to experience it. Instead of just immediately shooting you out to the universe, he gives you that time and space to feel into it and see how it feels. And it's like, okay, I think I'm good. And then we'll send you a little bit further out.
Okay, so with you saying that, then Shandell, are in the room with that person the entire time.
Yes. So when we work together, and I guess we can go through like what a series would look like if we were together. So when we work together, you have a phone call with both of us. You have medical evaluation with Nathan, and then you have like an emotional support evaluation with me, just so I can understand your intentions, what you hope to get out of it, help you with being very clear on those things and affirmations. Then we typically will come to your home and do there. If you're like, my home is not where I want to do it, then you can come to my home and we have a space for that. But then, like, I will take you through some breath awareness, through a little bit of meditation. I'll help you drop in and feel nice and relaxed so you're not feeling anxious before you get the shot. So I'm there to be right with you. And then I offer support if you are anxious. We talk about what that support can look like. And then if you're open to it, I also do energy work while you're under the medicine. What that looks like, we kind of talked about this today earlier, is when you're in a ketamine session, it looks completely different than when you come to an energy session on purpose with me. Within ketamine, I watch for energy that's coming up to the surface. If there's anything that's heavy, dense, a block, then I will support it and help it shift so that you don't get stuck inside the experience. And so I just do that to support you. I'm there the entire time. I basically, my eyes do not leave your side. My eyes do not leave you. I'm constantly watching just to make sure everything's good and safe. He is sitting over on a chair, kind of on the, not necessarily opposite side of the room, but close, watching all of your vital signs. So he has you hooked up to all of your machines.
Yeah, oxygen, heart rate monitor, continuous the whole time.
Yeah. And then he's watching you breathe, watching your heart rate the entire time. So both of us are completely present with you while you're under the experience. Then as you start to come out, I take any notes of anything that you say or you want to remember. With like Kate, if you have, since you're with a therapist, I would write down all these notes. I would give you those notes. You would take those notes to your therapist. So those are the things that you can talk about, right? Tanya, like if you would be like, okay, this is the stuff I need to think about or go dive into a little bit more. And then if you wanted additional support, then you could work with me one-on-one. And
That
then the
was so
next
helpful.
day, yeah, then the next day we have a follow-up.
And then, Tanya, I would say this too. Um, I mentioned earlier that the neurons sort of scramble your visuals, scramble your sense of body, scramble your thinking a little. It doesn't really scramble your thinking to the point where you forget who you are. Like your core thinking is still intact. Like while you're in there, you can be like, this is wild, but I know it's the ketamine. I know my neurons are firing. I know I'm on my couch. Shandell's right next to me. You don't lose like the sense of reality.
Mhm.
But it scrambles your thinking just enough to give you some different perspectives.
Mm,
And it's interesting because there's some authors out there that think that the experience doesn't matter. They say the healing comes from what it's going to do to your neurons afterwards, which is true. We talked about the whole neuroplasticity thing. That is where like the healing comes from. But I believe some of the healing comes from the fact that you end up with this different perspective. And so obviously I can't speak to exactly what would happen, but you may find that you get in the medicine with this fear that you're going to lose control, and then you're in there and you go, "Oh,
I don't know what I was
why do I
thinking
need to
about.
be in control?" Or like, am I really in control or anything? Like the world's gonna do what it's supposed to do. Or you go, I don't have to be in control because my husband's good and my kids are good and like nobody needs me right now. I'm like safe. And so you end up like facing like you do end up sometimes facing some of your fears, getting a different perspective on them, and coming out and being like, for 40 years I've been like feel like I needed to be in control. And like you know what I realized in there? That's all like that wasn't
That's
that's
funny.
nothing. Yeah, or like what was wrong with me? So and it's so hard to explain. Like even when we say you'll get visuals. It's like, what does that mean? Or we say you're thinking, like your perspective will just change a little bit. What does that mean? It's just so hard to explain. But people, and you can say this too, people typically don't have fear. It's more of a sense of like, like an exhale and like, why have I been this way my whole life? Like just like a
Mhm.
it's like easier than most people anticipate. Like more peaceful. And I will
Very-
say, having Shandell at your side is like such a great anchor, that just makes you feel like somebody is keeping you safe. And it's funny because I don't come from like the spiritual world at all. I'm like, show me the data or it doesn't exist. And and Chandell's very what metaphysical, spiritual, emotional. And so she's like, okay, I'm moving energy, I'm doing Reiki work, I'm aligning your chakras and lightening your crown or whatever.
I really need to update his verbiage around this, but yeah.
And I don't understand it, but what I see over and over, people feel like to just have somebody at your side who is like protecting your soul, who is like sitting there with like love in her heart. It's like this beacon of light when you're in this confused, like scary state. And so, yeah, you're like the person who needs Chandel at their side because a lot of clinics just plop you in a room and like see you in an hour. But
Well,
if,
that's what I've heard,
but with
right?
the,
Like the stories.
yeah, but especially if you have fear going in, like you will know that you have somebody who's protecting you spiritually, and then I'm there making sure that physically you're okay. Um, I guess we can talk about risks, but the risks are almost zero, honestly, from like a medical perspective.
Does that kind of help you at all, Tanya?
Absolutely. Thank you.
You're welcome.
I appreciate it.
I'll kind of give an example. I know we have other questions in like 20 minutes. Like we literally could talk about this for hours. But I'm going to kind of, as far as like the control thing, I'm going to kind of give you an example that's very common that we hear from quite a few people is even whether they were afraid of death or not, we have people who are afraid of dying, afraid of death. They go in that experience. I also had this experience. I'm not afraid of death, but I had this experience. And I was like, I could totally be dead right now. I don't feel a body, kind of floating out here in the middle of nowhere. I think I could be dead. And I'm like, it's kind of loud in here to be dead because there was like so many visuals happening. But we have had so many clients coming through and be like, I totally died in there. I totally thought I was dead and wasn't coming back, and I was okay. I was totally okay. I am so not afraid to die anymore. So it's that kind of like mentality of like the control, right? Like I'm afraid I'm going to lose control, and you just everything just like lets go, and you just are like, oh well, I'm okay no matter what happens. It's just all okay.
Yeah, it really is. It sounds so corny to be like, it'll open your eyes to a new way of thinking, but it really does. With
Mhm.
with what you said, with anxiety. So people will come out and be like, why have I been scared that my spouse is going to leave me? Like we've been together for 20 years. We love each other. Like there's no problems. And like all of a sudden they come out and they go, Chad, man, I've been like
Worried about nothing.
worried about this the wrong way this whole time. So, I mean, that shift in perspective, and I believe that that is kind of how it works overall. And just shift your perspective a little bit. Like just get out of that neural rut, that ski
Mhm.
track that's been skied 1,000 times. You just hop over to the side a little bit, take the new route, and you just go, not worried about that anymore. You know?
Okay.
Do
All
either
right.
of you
Well,
have any other? Sorry, Tanya, go ahead.
I think you've answered my question very well. Thank you.
Hmm.
Kate, do you have anything else?
No, I'm open to listening to other questions and
Yeah.
info.
I, for, I don't think either of you have done a psychedelic before. And so, one of this question is like, what is it going to be like? The experience is different for everyone. Like when he went through his treatments, his experiences were pixelated and blocky and squares. When I did it for my trainings, it was like a lava lamp and it was like ginormous. And I'm like, oh my gosh, does everybody see this? And like it was very flowy and I saw dark colors, black, grays, blues, reds. Some people, it's brighter colors. So we can't ever really truly answer that question of exactly what it's going to be like. Just know that your brain is going to create images and feelings in your body that it's trying to make sense of what it is. And the thing that you don't want to have to worry about while you're in there is why is it doing that? Like, what does this ship on this ocean mean? It's like, oh my gosh, there's a ship on the ocean. And then you can process the ship after you come back and you have your awareness back together.
Yeah. And again, it's so hard. Even describing it in words, you guys are probably like, okay, I still don't get it. Like that doesn't mean anything until you experience it. But that's usually our biggest recommendation is to go in with an open mind, be curious, be just ready to take in what it's going to show you, but also know that you don't have to do anything. There's no right and wrong way to do it. Um, just watch the coolest movie that you've ever seen for 45 minutes, and then you can try to figure it out later.
Yeah.
And a lot of people there are some people do get some messages or like
We've had people see their relatives who have passed on. We've had people see like angels. Or like what they would perceive as angels. We've had people be like, oh, this plant was talking to me and telling me this, right? Like, so we've had all sorts of different things. So nothing is ever going to be the same.
and we also the vast majority of what happens in there is just nonsense and doesn't mean anything either.
And it's so crazy because you like come out and you're like, I, uh, I don't know how to explain what just happened. And so they're like, there were so many things and then there was this, and then I don't know how to say it. So like, there's almost no words for what your brain produced. And so that's why I'm like there to take notes. Cause like, if you can get like one little coherent word out, then that's great. Not that you can't speak, but you just can't figure out how to describe what you saw or what you experienced. And part of that doesn't matter. You don't have to make sense of it all. It's just your brain being excited that you're trying something new, probably.
I had a guy that was like 60 some years old and he said, I thought that I've experienced everything there was in this life. I've had every high and every low and been in love and been hurt and he was like that was I've never come close to that before. And I was like that is awesome. And just that, I mean honestly, just that he was like glowing like that was the coolest thing in 60 years.
Yeah. I will talk because it says how quickly does it work and lasts? And I'm talking about the experience. So when we come to your home, we are with you for about 2 hours. You are in the medicine for about 45 to 60 minutes, and that's it. The rest of the day, depending on how you are, depending on like how you receive the medicine, you can be groggy for like an hour up to 3 hours afterwards. So you want to make sure that you have the time and space to really nurture yourself the rest of that day, but plan on being with us for 2 hours. Then when we leave, that's why we want to do it in your home, is so that you can relax and just be in your own space and do the things that make you feel good for, a couple hours after that.
Do you recommend doing it in the middle of a work week or saving episodes for like weekends where you have a couple of days to like take a mental check from responsibilities and
Well,
deadlines and
right.
things like that at work?
Right. If you are a person that lives in like a high stress and works in a high stress environment, I would say it would probably be beneficial for you to do a session on a Friday afternoon or Friday evening. So you have Saturday and Sunday to kind of get before you get back into the swing of things. But like really, because the medicine is so fast acting, you can go back to work the next day and feel normal, but you still want to take your intentions with you. right? You have to be even more intentional. If you know you're going back to work the next day, then you're more intentional of like, I'm not going to allow XYZ to trigger me today. I'm not going to walk into this meeting assuming the worst. Like, so there's things that you have to mentally prepare yourself for if you're going to jump right back into your everyday.
Yeah. From a physical standpoint, you're back to normal the next day.
Mhm.
Like she said, an hour for the medication effects, 1 to 2 hours of feeling kind of hungover and lightheaded and dizzy,
Tired.
groggy. Most people are back to normal by 4 hour mark, but especially with a night of sleep, you're back to normal the next day.
Yeah.
The And then I guess Chandel was kind of talking about this too. Like the psychedelic people talk about what they say, set and setting. So your mindset going into the experience and then the setting that you do it in. And that's kind of like the biggest, what you need to set yourself up with before you have a psychedelic experience. So you get your mindset
Mindset.
right, which is what Chandel and I will do with you, preparing you for like what to expect. And then the setting, what you do it in. So if you do it in a doctor's office, which is kind of clinical and sterile, that is not as loving and comfortable and it's not
Supportive.
supportive. It's not your environment. And that's why we go to your house. So you can do it on your couch or on your bed and have your blanket and your cat and your husband with you, or like you put yourself in this little cocoon of like familiarity and love, and that just sets you up for such a
Much better
better
experience.
experience. Yeah.
Yeah, overall.
I have kind of a weird question.
Yeah.
Because like you probably obviously work with strangers that you just kind of find and recruit into the experiences. And then you probably, because word of mouth, you have seen friends come in and experience this as well. And because, I mean, granted, we haven't stayed super close through the years, but I've known you for like almost 15 years. And I'm like, I have this very weird, like, am I going to embarrass myself in front of this friend? Or am I going to do something embarrassing or say something embarrassing? I know you don't judge, but do you know what I mean? Like,
Mhm.
do you think, oh, this is what Kate's going through, kind of thing? Like,
So, well, I'll do both sides. One, as somebody who knows you and has been friends with you for a long time, I really truly come from a place of neutrality. I am only there to support you in the best way possible because what I want for you, for Tanya, for Al, for everybody, right, is for everyone to come back to their hearts and be happy and experience life well. And if you're going through something and you're crying and you're like, I hate this, that I'm going through this, the only thing I can do is give you love and compassion. It would never come from a place of judgment. I would never come from a place like, oh, geez, she's a shit show, right? Like I just could never, I personally, I could never do that, right? I just couldn't. Um, Maybe 15, 20 years ago when you first knew me, maybe, right? But not now, not with all the work that I've done on myself to come from this place. And um, and then on top of that, like we are very professional, right? Like we don't get in the car and then just sit and like jabber about you. We're like, that went really well. We're so glad for her. And then we go about our day, right? And then also with all of the medical stuff, you are HIPAA covered. So like we cannot discuss anything outside of the space with you.
Yeah. So I'd lose my license if I told anybody about your medical care, and I make a electronic medical record just like any other doctor's clinic does, and it's all HIPAA protected. And when Chandel's with me, she's HIPAA, under HIPAA as well. So not only can we not talk about your experience with anybody, but like she said, we've we've seen it all.
Mhm.
Um, Ketamine is pretty mild in terms of like people having bad reactions, right? So people they don't really freak out like bad trips. Um, And
You're
it's
not going to do anything. You're not going to like start ripping your clothes off. Like
no.
your body's like gunk, like you're like
Yeah.
out. Like and even if you say something kind of funky, I'm going to be like, "Oh, I'm wondering if she's going to wonder what that meant later." Like, you know what I mean? And it's for you. It's not for me. And it's not about us. We are only there to support you.
I
And
mainly meant like if somebody's extremely emotional
Mhm.
during their experience or something like that, and like you said, was crying or something and incoherent, like how do you support a person in that kind of state?
Yeah, and that's what we do talk about that like in our pre-integration call of like the different ways that I can support you and which way you feel would be best for you in that moment. Because usually like once you're under and in the medicine, you're not going to necessarily know what you need in the moment. So we talk about it before. Like, do you want me to just hold your hand to be that anchor to know that somebody's there with you? Do you want me to put my hand on your arm? Do you want me to just say, Kate, you're going to be okay. You're in a ketamine experience. I'm right here with you. Let the tears come. Because all of the people who know me know that I love tears, right? They're like, Shandell always making people cry. And so if you're crying, I'm going to encourage you to keep going. I'm going to encourage you to be like, Kate, let it out. Sob, scream, cry, whatever it is that you need, it wants to come out. Let's let it out. So I'm going to be there encouraging the emotions, not discouraging the emotions.
Makes sense.
and I've seen her do it countless times. And it's kind of like if you cried in front of your therapist, you're not like this therapist is judging me, right? Like that you know that's just somebody who's there to support you professionally and just as a person, you know.
Yeah.
Yes, thank you.
Mhm.
Thank you for asking that question.
Yeah. Maybe just touching on that same way, because there was another question about whether there's a risk of it bringing up
Trauma.
bad previous traumas or like triggering some kind of emotional episode. And then I guess I'll
Go to
let
me.
you.
Um, so generally with ketamine, it doesn't bring up things from the past and old things. You can like have an intention of working through that during that time, and you may or may not get that opportunity because with any psychedelic, you're going to get what you need, not what you want. But it's very different from something like psilocybin. What psilocybin will do, it can bring up old patterns, old memories, old suppressed traumas for you to see and deal with. Ketamine doesn't necessarily do that. Ketamine is different. It may allow you to see something. So if it brings up something, it's going to be like, hey, look at this. And you're not going to have the same emotional reaction. It's not going to have the same, like, oh my gosh, you're going to be like, oh, okay. But it's not, it doesn't have the same traumatic effect that it did if you were going to do a different psychedelic. And so it doesn't. It might bring it to the surface, but the way you perceive it is completely different. But you don't go into like a full-blown experience of this is what happened and this is what I experienced. It's not as deep.
Ketamine is the only psychedelic that has a dissociative effect where it really does dissociate you from your body, but dissociates you from your emotions a little, and it's so hard to explain. But you know, like if you like say somebody was like the victim of a really traumatic sexual assault, and they're afraid that they're gonna have to like relive that trauma while they're in there. And I think, Shandell, you're kind of saying like psilocybin or LSD,
Mostly psilocybin.
psilocybin, you could actually have that relive that experience and it would
Mhm.
be, you know,
It could
horrible and it could
re-traumatize you
re-traumatize you.
if you don't have the right support.
But ketamine is really it really dissociates you so that even and it's also very abstract. So it's typically the visuals are not like I thought my dead dad was across the table from me. It's more like the feel that he's there or like knowing that he's there
It's
and
more of
it
an
an
awareness.
awareness. Um, and then even if you started to like think about that sexual assault while you were in there, like we said, almost like when people thought they were dead and then they're like, but I didn't care. People will process some past trauma and be like, you know what? While I was in there, I was really processing that sexual assault. And you know what? Like, I finally had a chance to like think about it without it triggering like a
All the
massive
emotions.
anxiety attack and all these emotions because you're just dissociated enough. And that gives you the chance to actually see things from all these different perspectives. So people don't really relive past traumas. Um, don't have bad trips because even if there's a distressing, I don't even know, even if there was a distressing like issue you were thinking about while you're in there, you kind of come out, you kind of are in there with this like, yeah, that happened. Like you're a little
It just
dissociated
gives
from
you
it.
a different way to perspective to
Hmm.
see it because your emotions don't flood you and overwhelm you trying to work through it. And that's where a lot of the times we get stuck is that the emotions are so strong that it's hard to keep going because you have so many emotions about it.
And then it gives you a chance to see it in a different light, and then you take that to your therapist and like continue working on it like you would have otherwise, but now with this new like experience that may let you approach it from a different angle or, whatever
Perspective.
perspective.
Yeah.
How far apart are your sessions? Like, how do you time them?
Um, we we recommend like between 7 and 10 days apart, but there's no like firm, you have to do it this many. Like if you're like, well, I can only do it every 2 or 3 weeks, then that's what we do. We are basically side to you. Like if you say this is how many I want to do, that's great. This is how close I can do them together, that's great. We don't say this is how you have to do it.
There,
There's
there's
recommendations.
there's like I said, hundreds of studies that were all done differently. So some studies did one treatment, some did three, some did six, some used the dose, this dose, some used a dose twice as strong. And there's not like a absolute like consensus to like the right way to do it, but there have been some papers where they do what's called a meta-analysis, where like the researchers will take a group of papers and try to analyze all the data together as one. And so there's like this big meta-analysis that took all the studies that did one treatment, all the studies that did four treatments, all the studies that did six treatments, tried to combine the data from those subsets and did a meta-analysis on it, and it showed that the studies where people did six treatments had better results. And so that's why you'll see pretty much every clinic has jumped onto saying six seems to be the magic number.
Mhm.
And even within those studies that did six treatments, some did them like 3 days apart, some did them a week apart, some did them 2 weeks apart. And there's not like an exact consensus to know what the right answer is, but we feel like we've seen people do the best with about a week apart times six.
Yeah.
Because it would be kind of emotionally and physically exhausting to try to do it too rapidly back to back. You come out of it kind of like beat up a little sometimes.
Yeah. Although we do have someone coming out for a week to just get them all done coming into town. So
Yeah, we have somebody coming from Ohio.
yeah.
Wow. No services like yours in Ohio?
Apparently not. There's no me in Ohio. What are you talking
Well,
about?
there's no you in Ohio. But I'm surprised. I mean, obviously there's clinics, but I'm surprised that there would be no other like home version
Mhm.
kind of.
I think she's using it as more of like a retreat for herself to like
Ah,
totally get away and just focus
Just
on
focus on
on
herself.
that.
Mhm.
that makes sense.
Yeah.
Yeah, there's not a lot of home um people offering to do it at home. There's some of the clinics around town that have that option, but think the cost is significantly more. And what's been nice with me is that I don't have like a brick and mortar, so I don't have a lease to pay on a
Oh, okay.
building. I don't have nurses to pay. I've kind of got my two big bags full of all my medical equipment, and Shandell and I kind of run it just through us. So the overhead is low, and our costs, I think, reflect that compared to some of the other places.
And I mean, I guess before we end, we can just talk about our costs real quick. So when we go together, it's $500, but that includes your medical evaluation and the pre and post integration calls, and then for both of us to come to you. And that's basically it.
Yeah. So if you look at all, I mean, 1, 2, 3 or 4 calls, and then up to 3 hours at your house for both of us.
Yeah.
10, 9 or 10 hours of work, for 500 is what we ask.
Yeah.
Did I see on is it the guided ketamine website? Did I see that, like, you're saying 500 per session, but didn't I see that you had a price for like a series of 6?
That was for our group. So we can talk about that too. So really how it kind of works, Nathan can go by himself to do people's sessions without me, and that's $400. For both of us to go within the integration, it's $500. But then we also offer group sessions, and we were doing a group series. And then we have not, which you should probably take that off your website. We have not done the group series. We just started doing every other week. We have group sessions. So like if somebody wanted to do, a group session and then a session on their own, then they would pay the group session, which is $350. And when we do groups together, we do them here. I do meditation, breath, sound bath. Then they go into the medicine, and then we have an integration circle afterwards. So you get a lot more for a lot less when you do it in a group.
Yeah, and I'd never been involved with a sound bath before Shandell, and I'll tell you, those groups where she puts you through some guided meditation and some gentle breath work and then does the sound bowls, like people feel like they're dropping into this almost like meditative, almost
They're already floating
psychedelic.
before they
Yeah,
get
they
get
are.
the medicine.
They're like already like feel like they're having a little out of body from like the whole like preparation. And then that is like such a smooth transition into the ketamine experience that the groups are actually pretty amazing.
Yeah. Okay. A couple things we didn't get to, but I think we'll try and do this again. So
Yeah.
cool. I super appreciate you both for being on
Yeah.
with us on
Thanks.
the Zoom. Thank you so much. And then if you guys have questions, just reach out to us directly. We're happy to answer any questions.
Cool. Thank you for your time tonight.
Yeah. Thank you.
Thank you. I
Okay.
appreciate it. Now
Yeah,
does too.
yeah, thanks, Tanya.
Okay.
All right.
See you
Okay,
guys.
Have a good
bye.
night. Bye.